Hello, my viewers. My name is Madam Wachira. I'm an addiction counselor, and I'm here to highlight on the dangers of alcohol and drugs. When we talk about drugs and alcohol, what are we talking about? What are the effects of drugs and alcoholism in our lives? Effects on families. Am I an alcoholic? Ask yourself, am I an alcoholic? Alcohol in the workplace. When you are drinking and you're working, what are the effects? Is it affecting my work? What are the factors contributing to employees drinking? And what are the preventive strategies? This is why I'm here to highlight on the effects of drugs in our children. One starts experimenting when you start sipping maybe an alcoholic drink, pombe, wine. And addiction does not come within a day. It takes time to manifest. And that is where we experience. Sometimes we don't know our children are using. But at the same time, there are some symptoms we see in our children. And we can tell that something is wrong and they are using. Sometimes they are in possession of drugs or related paraphernalia, items like empty bottles, needles, syringes, or maybe even tobacco in the pockets. And then we have odor of drugs and cover-up scents. Sometimes we find them chewing gum. They want to cover up, maybe they were smoking bangi and they don't want, they are scared that you may identify that smell. Then we have identification with the culture, like music. He is getting those music that are related to maybe another cult, the one you can't explain. Reading materials, dress code changes, and conversation and jokes, they change with time. And then he becomes, or she or he becomes dishonest. Sometimes you send him to the shop, and that item, when he wanted a big item, he buys maybe the medium one, and then the change, he keeps the change. And then it becomes, that is dishonesty. Then in discipline, you find that there are times that he doesn't go to school, but you won't know. He goes to school in uniform and disappears, or maybe puts in his bag home clothes and disappears until the teacher tells you he has not been in school. Then secretiveness. He comes late. He doesn't want you to know when he came. Maybe he comes through the back door. And he also can get also secretive and can get an enabler through the brother or sister who will open the back door for him so that he may go direct to his room without you knowing. Then we have the rebellion. A rebellion from parents, rebellion from school. Then we have irritability. Because of the drug of use, maybe he never slept well, or maybe he's high on something. Maybe he's not really drunk, but he's high on something. You find him getting irritated, or maybe becoming even rude. Then company of questionable people. These are our children. These are even our siblings. Somebody just going wayward starts moving around with questionable people, then disappearing from house for short intervals or for long intervals. These are the telltale signs that someone is using. Addiction, alcoholism and drug addiction affects the brain. And when we say a drug is any chemical substance which when taken into the body will modify or alter the way the body functions from its normal state or from the abnormal to normal, or from normal to abnormal. And drug abuse, generally drug abuse is the non-medical use. Non-medical means when you are not given drugs by doctors and there are some substances that make you high. This is what we call drug abuse, because they make you high, they alter the psychological state without medical supervision. They change your brain and thinking. Drug abuse will often lead to pathological drug dependency. A condition in which the abuser is the one who is using it, is no longer able to stop using the drug, even when the habit is causing serious damages to him or to others. The person who is addicted by whatever substance is not able to tell that he is messing up. Is not able to tell that he has changed. You cannot tell. Myself, I was a victim. When I was drinking, I didn't know my habit had changed until when I got help and I realized my people, my children, my husband were suffering, and the brain changes changes in the thinking and behavior, because the brain is the engine of the person. What is alcohol? Alcohol is a chemical compound produced by fermentation of sugars using yeast. So, the alcohol itself and bangi, which are the most abused drugs in Kenya, I can mention a few. They are kubero, alcohol, bangi, miraa, inhalants. We have prescription medicines which are bought in the chemist. Then we have changa, and then we have these the plastic ones. So we have also had drugs like heroin and cocaine and man drugs, which are also in this country. And because we are talking about the cigarette being one of the drug, we talk about tobacco-related ailments, tobacco-related problems that are brought by tobacco. And then we talk about nicotine, which is prevalent in the tobacco. Nicotine is a colorless, poisonous chemical present in tobacco and is highly addictive. It is readily absorbed through skin and mucous membranes to the central nervous system as a stimulant. If taken in large amounts, it can cause fatal seizures. The addictive power of nicotine can be measured by the number of smokers who have great difficulties in stopping the use of the drug. So, cigarettes, I have worked in several rehabs, and there is a very, very big problem of that person stopping the cigarette smoking as opposed to the beers. And so these are the symptoms we are talking about of substance abuser. He disappears from the house from short intervals to long intervals. Loss of personal items. You lose items. Simu imepotea, telephones. He may even lose a jacket, a very nice jacket. He may also come sometimes without shoes. He'll buy some slippers he'll wear. Because the shoe was very expensive, you sell it. Then dramatic change in performance in school or at the workplace. Weight gain or weight loss, and sana weight loss, because the person who is abusing drugs does not eat or eat erratically, meaning he can eat once a meal or nothing at all. Then we have discolored teeth, mouth and fingers. We have deterioration in personal hygiene. This person does not take a shower. Slurred or incoherent speech. When one is drunk, you can tell now how he talks, because you not hear what he's saying and he thinks he's communicating. Then watery eyes and nose, dilated pupils or red eyes. A person who is using will have red eyes and takes a lot of water. Constant trouble with the authority. If he is drinking and driving, of course, he'll have problems. These are the telltale signs. And what are the warning symptoms of alcoholism and drug addiction? Physically, the body now, you'll have head injuries or headaches, loss of memory or blackouts, partial or total memory loss of events. He may even forget that he slapped you yesterday. He may forget even where he is, even whose direction to whom. Morning nausea, morning sickness. He may even go through impotence, inability to achieve, Impotence means the sexual organs are affected. Then we can have past ulcer operations. We can have we can have ulcers, because most of these people who are using drugs, they suffer from ulcers. Then we have indigestions, very prevalent, unexplained seizures. There are some people we have admitted in rehabs and they have gotten those seizures, and they are fatal, and they can easily kill. Vomiting of blood. Then he can go through when he's acute. This is acute when he's gotten rock bottom. Rock bottom is where this person can get out, cannot stop using on his own. He needs help. He can get pancreatic disease, infection, or the pancreas is affected. He can get frequent infections, be it through the mouth, be it homa, be it... Then we have withdrawal symptoms like tremors, seizures, abnormal heartbeat. Behavior. How is behavior of this person? He is full of mood swings. He can even go to depression. He can acquire aggressive behavior when they are addicted, or when they are high and you're asking him questions about the rent is not paid. He can acquire an aggressive behavior. He can also have suicide threats or attempts, because he is feeling like he is a failure. Shame and guilt is eating in him. He can also have regular or prolonged use of tranquilizers or sedatives. He can have also anxiety. He can also have take overdose on pills, and without even him knowing, because if he was already prescribed medication by the doctor, remember he has not been taking them, and there are times he just feels that because he has not taken for several days, he can take for those 3 days. He can have repeated attempts, even repeated attempts to stop drinking. He may be trying, but he's unable to stop drinking. History of increased tolerance to large amounts of alcohol and loss of such tolerance. The more he drinks, the more the body wants to drink, the more the body wants the drink. So he may even have, if he was getting high by 3 beers, he has now to take double that amount to get the same high. That is why, sana when we are taking alcohol, we turn to the hot drinks. Then you have cravings and fatigue. Cravings, that is why sometimes that even when I was drinking, kutoa lock asubuhi, you feel as if here it's blocked. And the best thing you think about it quickly is how you can get a 50 bob or 20 bob to go and kwa mama pima, nearless wines and spirits, to have that thought. Then as a family, this person who is using can easily get a divorce. One, the duties of a husband or a mother, they are abandoned. Children with behavior problems and bad nerves, they can cause also depression and anxiety, because even the children themselves, if they are drunk or they drink and they're in college, they can also get nervous breakdown, because one, the parents will be asking where his school report is, and he has not been going to school. Like the college students who stay away from home and they are rented out, wherever they are rented, sometimes they can sleep the whole day, drinks in the evening, and the parents will not know that he stopped going to school. Decreased social life. This person, when the person is drinking, disappears from his friends because of the shame and guilt, and he doesn't want to be questioned. Then he has financial difficulties. This is the key area where you find people selling their own clothes, selling their own furniture to fund the drug of choice. He can also become a child or spouse abuser. The person, if he is a mzee, a man, a lady, will become a child abuser, will beat up the children, but they will not remember. There is something we call the memory blackout. Then fewer friends, because there are many friends who will disappear. when they find this person behaving the way they are doing, and he really goes out, the person isolates himself from the people who loves him. And then we have the occupation hazards, absenteeism from work, absenteeism from school, job-related accidents. We have also factories where people operate machines, and we have had people who have died because of job-related accidents through the machinery. We have someone whose trouser was caught up by the machine because he was high, and then almost his leg disappeared in the machine, and he was amputated up to the knee. That one is somebody who happened. I knew that person, but those days I wasn't drinking. But this is the time I reflect backwards. Increased insurance claims because of car accidents. Maybe even you fall down in pits, poor performance in school, poor performance in jobs, poor performance at home, loss of job finally. After all these warning letters of poor performances in school and the outcome of whatever you are doing, of course, you lose the job finally. Complaints from superiors and co-workers, your supervisors, they complain until they get tired. That is why now, after very many warning letters, you'll get sacked. Periods of unemployment or an early retirement. Periods of unemployment is that when you are sacked, you start looking for another job. And when one is addicted, one's priority changes because you not look for another job, because now you start complaining and the blame game starts that those people are against you. That is why they sacked you. Frequent job changes, moving from a job to another one, and another one, and eventually being sacked in all of them. What are the legal implications? Frequent car accidents will have legal implications because even the insurance will spot that there is something wrong with you. And then we have driving while under the influence. Of course, your driving license will be taken away. Assault. There are many people who have been charged with assault because the brain is not working and you overreact when you are high. You are already disorderly, and the conduct of resisting arrest can happen, and then you are now public drunkenness is identified. Physical sign of alcoholism and smoking, cigarette burns in your fingers, yeah, and poor health because you are not eating. An addicted person does not eat well, and now this is where, when you have such a person, and when you identify that you have a child or a spouse, or even a neighbor who is not okay, or maybe you hear the family telling you something is wrong with my son, this is where I come in. I am an addiction counselor. Me too, I was affected by alcohol, and for me, my life took another turn. Fortunately, and I say thank you to God, because I was taken to a rehab, and eventually I trained as an addiction counselor. I'm passionate about what I do. After losing a lot, I lost my family in alcohol addiction. I trained as an addiction counselor so that I may understand what is this that affects the person as an addicted person. How does that progression of the addiction manifest itself to the point that you lose a family, you lose a loved one, you lose jobs, you lose a spouse. And that is why by God's grace, I'm here telling you that there is hope. If you have someone who is addicted, you have a neighbor who is addicted, you have a loved one, or a spouse, or a wife, please do not give up. You cannot buy life from the supermarket. And when you have such people who are addicted, that is where I come in. We do an intervention. An intervention is where I come in now, because as I am knowledgeable in this area, and I was a victim of this alcohol. An intervention can motivate someone to seek help for alcohol or drug abuse or other addictive behaviors. It is challenging to help a loved one struggling with any type of addiction. Sometimes a direct or heart-to-heart conversation can start the road to recovery. But when it comes to addiction, the person with the problem often struggles to see it and acknowledge it. We have so many people, even in the rehab, who come seeking help, and they are full of denial. We counsel them in the sense that because they share the story, so that they may see that story in the other person and identify with that person, that they too, that person too came because he is sick. A more focused approach is often necessary. You may need to join forces with others and take action through a formal intervention. This person needs to be with others so that as they share their story of addiction, as they share about what exactly happened, how did you start, how did it progress, how did the addiction progress, what are the consequences of my drug of choice, what actually happened. Maybe he was sacked from job, maybe the other one was also, maybe he had an accident, or maybe he escaped an accident, and by God's grace, now someone brought him to the rehab. Someone in the family identified that he had a problem, then he brought him to the rehab. Examples of addiction that may warrant an intervention include alcoholism, prescription drug abuse, street drug abuse, compulsive gambling. Gambling is also a sickness. Internet addiction, Facebook, WhatsApp addiction, and pornography. There are so many things that today we are having a lot of addictions. People who struggle with addiction are often in denial about their situation and are unwilling to seek treatment. And it is true. They are unwilling to seek treatment because they do not recognize they have a problem. It is not that they are pretending. They have no idea that they have a problem. They may not recognize the negative effects their behavior has on themselves and others. An intervention presents your loved one with a structured opportunity to make changes before things get even worse, and it can motivate him or her to seek or accept help. So this is where I come in as Madam Terry Wachira, a therapist, an addiction counselor. I'm also a marriage and family counselor. That an intervention can help to make this person recognize the negative effects of their behavior, plus even what they are using, where it is leading them. What is an intervention? When we say a therapist or a counselor is coming to do an intervention to your loved one, an intervention is a carefully planned process that may be done by family and friends in consultation with a doctor or professional such as an addiction counselor. It sometimes involves a member of your loved one, family, or others who care about the person struggling with addiction. During the intervention, these people gather together to confront your loved one about the consequences of addiction and ask him or her to accept treatment. The intervention provides specific examples of destructive behaviors and their impact on your loved ones with the addiction and family and friends. They offer a pre-alleged treatment plan with clear steps, goals, and guidelines. Spells out what each person will do if your loved one refuses to accept treatment. In fact, this is what we normally do. We sit with the family, we discuss this person and his behavior, his current behavior. If he is violent, what approach to take. And we also discuss, if this person refuses treatment, what other approach can we take? The family therapy is important in drug and alcohol use disorder drug or alcohol misuse disorder treatment. It increases engagement and retention in the treatment. It reduces the identified patient's drug or alcohol use and improves both family and social functioning and discourages relapse, hence transforming lives. Even after we do the therapy in the rehabs, we tell the families not to cut off from us completely, because there is something we call aftercare. And even after rehab, this person, we encourage the family to give him or her a lot of attention and comfort and love, and also to identify a course which this person can take, something that he can wake up and do. Because in the rehab, we do have training sessions. They wake up and go to class. So when this person goes home, it's not to sleep. It's to wake up and go and do something. Even if it's helping a certain shop somewhere, internship, or even volunteer work, it helps a lot. While you also, he gets more and more encouraged to stay away from the triggers, which in fact that is our work in the rehab, where we tell them now, you cannot now go back to the people, the same people that you are using with. You cannot go back to the trigger places. We say PPT, people, places, and things. People who are using are no longer your friends. Places where you used to go, it's a no-go zone. And things that used to trigger you, you must change the way you used to live before. Identify yourself with the people who are not using. Go even to church, go have church activities, and more so be busy, so that in the evening when you are tired, you are home and you go home early. I want to say this: addiction is a disease that affects not only that person, but affects the whole person. The whole family is sick when one person is sick. When this person, stages of addiction fall, there is a pre-contact where you have not taken a drink and you take a soda, and then you have someone who is taking something else. And then you have the social use where you start using once in a while. In fact, a social user does not plan to come and take anything. Maybe he's coming to sort out a few businesses with business partners, and then he takes like a thought. And sometimes he just forget about it until the other time when he'll need to sit with the same people or different people in a certain area, in a certain club or something. Then you have the problem use. Problem use is when you are using and you have neglected some of your duties like rent, school fees, or maybe even feeding your family. Then we have that, the fourth stage is rock bottom, where you get in the morning, the first thing that comes to mind is to have a morning drink. That is what we call kutoalok. We want to say this: addiction is a disease that affects not only one person but the whole family. We normally say one person in the family is infected, the whole family is affected. We normally say addiction yote, all those addictions, sex addiction, workaholic, WhatsApp, internet, pornography, drug and abuse, they are not a respect of any age. You can be 80 something years and you can be addicted. You can be 17 and get addicted. The other thing is depression is coming so fast, because after this person loses that job and he is a family person who was so responsible, he feels useless and worthless according to him. Nobody has called him that, but he feels inadequate. He feels a failure, and that is a very bad feeling, where some of them, they go and they become depressed or eventually commit suicide. Let's talk to our people. Please, let's not leave them the way they are, whether they lost the job or not. Let's give them love. If they have not gone, our children have not completed their school, let's talk to them with love and pass them or bring them to a therapist. And that is where I come in, and I'll give you my number. Please get in touch with me, and let's see the way forward, how we can help each other. Madam Terry Wachira, and thank you so much for listening to me. My number is 0724 115940. I'll repeat my number: 0724 115940. Thank you for listening to me, and God bless you.